Yeah, I think that's important information for everybody to hear, because as we watch this unfold, and that is, as I go back to the main reason why we're doing this to bust the myth of this. This is really not a pandemic, and it's not doesn't have the I would say potency of what they anticipated in terms of a death rate. Initially, Trump was told 2.2 million, and then a week ago we had 59,000 people. Now we have 37. So they keep readjusting. They're getting funny with the numbers. And so we, the people, not sure what to believe, but we do believe the physicians that are taking care of us and that really care about us. Now, I've got some questions here, and boy, oh boy, people are one of the biggest things. So if I look at this,
And Jen, do you mind if I say something real quick? Because we have a short amount of time. I'm willing to go longer if we want to go longer. We have about 8 minutes left. It's up to all of you. I'm up for it if you're up for it. I do want to thank the donors. Jonelle Rains, $20. Randall West, $20. Tia Thompson, $100. Joseph Adonisio, $100. Bernadette Val, $25. And I'm waving my flag because this is how we spread Americanism. We fund Americanism, and that's what we need to do as Americans, is do our best to fund the American cause. And all these funds are going to the John Birch Society to help fund field coordinators like me. I thank you so much for making donations already. Joseph Searing, $25. Brian Hooper, $100. Marilyn Held, $50. Edward Handline, $10. Jan Barton, $50. Liz Nickum, $25. David Evans, $50, and Gregory Hamilton, $30. Thank you so much for being Birchnar boosters. You're the ones that are helping to make this happen. We do these 2 times a week, and I didn't want to get in the way, but we did promise in the email that we would recognize our donors, and we had a goal of $500 raised for the John Birch Society. We are at $610. So thanks so much, everybody.
Hey,
and also thanks to Jan, because she did everything to make this happen.
Oh no, listen, these ladies, I give them all the credit, because we're going to hopefully do this in other parts of the country with the John Birch people, because without people who really understand and are willing to get activated, contacting your elected representatives face to face, on Twitter, on making phone calls, telling your people in the neighborhood, we need to stand for our constitutional rights, and it's the people in this organization that have done that already. But I want to get back to, well, the main purpose is here is to bust this. This is not a virus that we need to be really afraid of, right, ladies? I mean, it's not going to creep up and we're all going to die, because that didn't happen. And the reason it doesn't happen is because if we take care of our immune systems, then we can fight this off. But if you're at risk, if you're a cancer patient or you have some underlying conditions, some Lyme disease and stuff, you're at risk. And actually those people are more in line to get preventive hydroxychloroquine and zinc. That makes perfect sense. So I have a number of questions regarding hydroxychloroquine and zinc, but also the question of, do we want to wear a mask? Do we want to wear a mask everywhere we go? And how that affects our oxygenation in our lungs? And what is the real purpose of wearing a mask? And where's the science? So I'd like to know, where's the science behind wearing a mask? Where's the science behind 6 feet apart? What's going on, ladies? Where's that science? And maybe we all need to be asking those questions. Does anybody have an answer? Do either one of you have an answer on that one?
Dr. Will?
Yeah. Oh, go ahead, Karladine.
I think that at the very beginning, especially those that were directly exposed, that a mask probably was the thing that we should have been doing. It was on mask, off mask. Nobody could make up their mind. I think that we're at a point where we need to have some exposure. And I don't think that the masks at this point are really of that much value. Now, Dr. Wool may disagree, so go ahead.
I agree with you that, you know, this has been a circus from the beginning. It was, you don't use a mask, you can't use a mask, you're going to hurt yourself if you use a mask. And then it's like, do a mask. And now you can't get into some places without a mask. You know, does it help? Let me ask you this. Why do we use a mask when we do surgeries or procedures? You know what? I mean, there are indications for it, but when you're doing the general population, and if somebody is sick, you actually can have very low, you know, I just got done telling you that there were so many extra cases of people that actually have this virus, and you put a mask on them, and if they've got any kind of a lung condition, even if they don't know that they've got it, they really could drop their oxygen saturation. So that's that little pulse ox that you put on your finger, and you can see what you're, you know, how you're oxygenating. So I think that's a double-edged sword, to be really honest with you. The way that they're using it now, it's ridiculous. The way that it's gotten into, and it's becoming, you know, all you have to do this or else. I think we need to open up. We need to be exposed to different people. We need to touch people. We need to have eye-to-eye contact with people. I mean, this is all part of how we heal. Now, with the other thing that I really want to say is, what we know of this particular strain of virus seems pretty benign. Could somebody drop another virus strain that could be a lot more dangerous? Absolutely. Are there some of us that feel that this was a dry run for something else? Yeah, there are some of us that feel that way. So whatever we're saying today may change next week. That's why you have to think critically. The last thing I'm going to say, Jan, and I'm sorry, but somebody posted on here 10,000 international units of vitamin A day. Absolutely not. You do not take that. You will get toxic on it. So those vitamin restrictions, you have to look at the recommended daily allowances. We do need higher vitamin D3 levels. D2 is not absorbed very well. We do need vitamin C, 1 to 2 grams a day. I mean, Linus Pauling, who won the Nobel Prize, used to take 8 to 10 grams of vitamin C a day. I am not advocating that. I am just saying that probably 1 to 2 grams is really okay. If you take too much, you have the runs. And then vitamin D, vitamins, and then zinc, 25 to 50. And men need zinc and women need zinc for appropriate, you know, hormonal regulation anyway. So anyway, thanks.
We are at 8 o'clock. Who wants to keep on going? Keep going?
Yeah.
Okay. So I have a really important question here. And this is about, this is from Janelle Rains. And can you address the plasma from people who have survived the COVID virus being given as a therapy to people who are presently struggling? Is it successful? The plasma, you know, they're taking antibodies and they're giving it.
I have no information. I do not know. I have no information.
Okay.
I have been reported that yes, that it has been successful.
And the cost?
Yes, thousands and thousands of dollars.
Absolutely.
Of course, the plasma is acellular. I understand that, but I've still been asking. I've had patients that have called me, or families that have actually called me from around the country. And I have asked that the blood still be checked for antibodies, whether it have an IgG and IgM antibody, because if they still have the IgM antibody, they're still carrying the COVID virus. It can be contagious. And that's one thing that I think that we haven't talked about. And that's something that I think that we need to talk about, because if you have an IgG antibody, then you have built up immunity to this COVID. And you certainly shouldn't be anyone that should even consider taking a vaccine for it. You have immunity to it now. And don't get me started on the vaccine, because I am not for this vaccine at all. Now, and people ask me why. Well, I can go into that in a minute. But the IgM is the infective portion of the COVID. And we need to know when someone is, if they're IgM, say that you come in and you say, you know, I have been around somebody, I've been exposed to COVID-19. I work side by side with this person at the grocery store or whatever. And so we run that and we see that you have IgM, which means that you've been exposed at least to the COVID-19. Now, in my thinking as a physician, I should be able to say, all right, now, Jan, you've got the IgM. Do you want me to give you some prophylaxis hydroxychloroquine, which would be a very low dose with the zinc, and then we will follow your antibody test in about 2 weeks and see how you're doing and then see how you're feeling. To me, that would make more sense than saying, well, we'll just call it the luck of the draw. And just, you know, if you get it, you get it. And if you don't, well, that's great. I just don't understand that. If I have a patient that came in and they tested positive for strep, but they don't have any symptoms, but yet maybe for some reason I did a strep. I don't know why I would, but if I did, wouldn't I just go on and treat them? I mean, to give them something instead of just turning them out to the general populace, for them to actually have a higher viral count to where they're spreading it, not only to the community, but to their loved ones. I mean, absolutely. I mean, we have a case now in Washington, D.C., and the parents both had COVID-19. Well, lo and behold, this just a few days ago, their 16-year-old boy came down very ill, and they had to take him to the emergency room, and he literally crashed in the emergency room, and he is now on a ventilator, 16 years old. But unfortunately now, their 14-year-old now has come down with it as well. And so, but if those parents had any type of idea and they didn't feel well, they could have gone to their doctor. If this wasn't such a controversial issue that our government and the media have made it, they could have gone, gotten a test, seen that they were IgM positive in all likelihood, had the hydroxychloroquine, and I bet anything their sons would not be in the hospital to this day. And one of them on a vent. And so it just doesn't make sense to me at all what we are doing or why we are doing it. And as I want to go over one thing that the hydroxychloroquine does, and I just want you to kind of visualize this. The hydroxychloroquine, as I said, does not kill the virus. Now remember, always think of viruses as bureaucrats. They're parasites. They live off of something else that has to make energy or make something for them. So they want in that cell. What the hydroxychloroquine does, it's sort of like I've always said, it's kind of like staining your deck. It actually puts a coating almost around that cell, and it disallows, or it stops the virus from going in. Even though it wants in, it prohibits it. Therefore, if it doesn't have anything else to live on, it itself succumbs and dies. Now, as you have the hydroxychloroquine, you lower that viral load in giving it to others. And if some happens to get into the cell, that's where the zinc comes in, because the hydroxychloroquine opens the cell for the zinc to get inside of the cell. And it actually zips up the replication of the virus. That's how they work together. And I want people to understand that. And by the way, it does not cause your teeth to fall out or your hair to fall out. Please don't be afraid of this drug. I have so many of this medication. So many people now are more afraid of the medication than they are the virus. And it is such a tragedy to see them as they continue to go downhill.
It is. And there's a point that was noted here by Emery Leonard that on March 28th, the FDA placed hydroxychloroquine on emergency use authorization restricted to inpatients only. So this is, kind of stopped the distribution to the general community. And who did this at the FDA, and how can we get the drug returned to where it was, which left off-label use to the treating physician, which is what we've been talking about, that a government bureaucrat should not be telling a licensed physician how to practice medicine and what to do with these medications. And in my research, I have discovered that this is coming from CDC to the health departments, and the health departments are instructing the boards of pharmacy, and they're making decisions. And this goes totally against how people are supposed to practice. You practice within your discipline. As a nurse, I have certain parameters on what I can do. As a physician, they have their parameters. As pharmacists, they have theirs. But I have never, ever seen a pharmacist say, sorry, you can't prescribe this off-label, and it's a pretty benign drug. So why did the FDA, do you think, take that position on March 28th? And by the way, didn't Dr. Zelenko have a conversation with Hahn at the FDA?
He did, yes. And that was actually, Jan, that was in regard to his study.
Okay.
It wasn't necessarily about the drug being held or put in a certain place, such as in the hospital.
Okay.
I've been asking that question now ever since it came out. And if you remember correctly, the FDA recently, as well as the CDC, they seem to be making more and more of their comments on a Sunday afternoon when nobody's paying any attention. They seem to be more and more doing that. And that's when they released the information that it would be only in the hospital. And then later on, they took down the hydroxychloroquine completely. And then I think it was on a Friday afternoon several weeks ago that's when they said that it can cause this horrible QT interval problem. And not really explaining that, but just putting fear into people. Now, remember, a fearful people are a people that are much easier to control. And so that also can be part of it. And so they have put that fear into the people. And like I said before, they've also put fear into the physicians. So we really have to look at this. History does prove itself, and it brings out the truth. Remember what the scriptures say, the truth will set you free. And that is so right, because the truth will set people free. It will give them a lot of their health. Now, I don't expect you to do like they do in Africa, where they have hydroxychloroquine on most all of the store shelves. You just go in and buy it, like you do a jug of milk, or or anything else. And so I don't expect us to do that. I think that it should be done through your family physician, and I think that your family physician also should be actually watching these antibodies, the IgM and the IgG. I think that they should be watching those as well, and be allowed to do that, because for a long time there, the CDC wouldn't allow them to allow physicians to be doing these in their office, the IgM and the IgG testing. but we need to know if you have IgG, because if you do, you have immunity, you need to get back to work. You need to get back out into society and live again. And so I think that we need to re-look at what we have done. We have shut down our economy. We have tanked our economy. We have put fear into individuals for a little over a half of what the flu deaths were in 2017 and 18. This is a tragedy.
It is, but you know, people are asking their questions and they're saying, well, if they're limiting access to hydroxychloroquine, if you have physicians who are afraid to prescribe it, then how do you get the drug? And I can tell you, I spoke with somebody, Boyd Parks, last evening, and he said he talked to the pharmacist, and the pharmacist here in Georgia said, well, we would give it to you only if it meets, if it's prescribed for the conditions that it's already been known to treat. And that was not going to be COVID-19. So here you have in Georgia, the pharmacy saying, if the physician prescribes it, we're not going to dispense it. And as I researched this, I saw where the Department of Health, Dr. Toomey, had written a letter regarding the fact that this is not a proven drug and blah, 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 blah. And therefore, we're going to keep it for these people who have lupus and RA, and we're not going to waste it. And that was displayed also on the Board of Pharmacy's website, which is what the pharmacists are going by. So if that's the case, what can we do? And this is just Georgia, and I know it's being in other states too. But I do know that some of you are able to prescribe it where you're at. Am I correct? Dr. Wool, are you able to get that?
Well, you know, interestingly enough, this last weekend, I did write for hydroxychloroquine because there's a young gal that was having trouble breathing, and it really sounded like she had something. And she's the daughter-in-law of a physician. And so I called it in and found out that, well, but the threesome, right? The triad, the hydroxychloroquine, zinc, and azithromycin. And I found out Saturday, she never got it. It wasn't filled. And I said, why? And the pharmacist said, well, I didn't say no, my boss did. And there was an order come from the FDA that said that was restricted. And I said, well, since when? Because it's always been that we had to do it with certain parameters. And if I've got, you know, a good clinical suspicion, which is what I'm trained for decades and decades, then I can go ahead and write for it. I mean, it's my license. It's my relationship with the patient. It's my instruction to the patient, and I follow up with them. So they said no, basically. And I said, you know what, I'm going to write your names down. I'm going to put it in the patient chart. And if something happens to her, I'm holding you responsible. And I think that's where people need to be. People need to be in their face and go, really, Governor, you're making this decision? Where did you get your medical license? Under what authority do you have to do this? You know, because we do use 1 out of 5 drugs off label, and this is capricious, and it's just, it's political. This whole thing is political, and we need to really fight back. Constitutionally, they don't have a right to do, they don't. The other thing I want to ask your audience is, since when do you quarantine healthy people? Think about it. Never. Which goes back to, they've done everything the complete opposite of what is standard of care, right?
That is correct.
Of anything. And unfortunately, we don't have enough physicians speaking out against this because they're held captive as employees of healthcare systems. And I understand that they've been threatened when they've tried to speak out. So this comes back to us. With your help and with the help of other physicians, we can speak out. We need to be going, just like Dr. Wool said, to our governor, to our state representatives, to our pharmacy boards. And we need to be actually educated on the issues and just to refute all this and say, this is against our constitutional rights. You are denying us access to life-saving drugs. And there's a law that says dare to try. And this is under that dare to try. Unfortunately, nobody's been doing it.
It
But I
isn't.
do know that, oh, go ahead.
I'm so sorry. It isn't under the right to try.
No?
Because the right to try, he talks about drugs that have not been approved by the FDA. This drug is approved by the FDA and has been for decades and decades and decades. They're just simply taking it off.
So, but on the flip side of it, they've said that they're not approving it for use. And that's where we're just like caught in this vortex. But I think that there could be an option for people out there. So can you talk about this telemedicine consult, either you, Vicki, or Karladine, where people can access that if they cannot get a physician to get them that drug, or the pharmacy to dispense?
Well, we have a program called TeleMD, TELMD. And right now it's being housed on CorsiNation.com. Corsi, CORSI, Nation.com. And you can see a link up at the top, and it says TeleMD. And you can actually, there are physicians in all 50 states that can see you on a telehealth visit. And now we don't guarantee that you get the hydroxychloroquine, the zinc, the azithromycin, the vitamin D, and so on. We don't guarantee that. It's not like dial a doc for your drugs, but what it is that you actually see a physician, they assess you, and then if they feel that you do qualify clinically for these medications, depending upon where you are in that stage and your findings, then the medications are overnight to you and put on your doorstep. And those are even in areas where they are prohibited, such as in New Jersey. New Jersey is one that was prohibited, couldn't get it, but it can be delivered there. Until just, I believe this week, Texas was the same way. And it could be brought into Texas that way. And it's at a reasonable price. It's not a gouging of the medications. But we tried to do this in order to make it not make money for some people that I'm certainly not making anything on it. And I don't have an interest in the company. I just am telling you that this is an alternative. You might have a loved one. You may have someone in a nursing home that's starting to run a fever. And you're concerned about mom or dad that's in that nursing home. And you want them to have this medication. Well, maybe they need to have such a visit like this and have it delivered to them. And it can be delivered directly to them and within 24 hours. And so I think it's important because I had someone in Pennsylvania, a physician, and just they can't have it there and can't order it there. And they were just going on and on about how terrible it was. And I said, sign up with TeleMD and go around the government and do it in their face and say, now, here I go. I mean, step out and step up. It's time that we did this. It's past time that we did this. And unless we do, I'm telling you, they're going to continue on taking more and more from us every single day.
So ladies, this lack of hydroxychloroquine has nothing to do with a lack of quantity. And is this all being stored at this strategic national stockpile? That was a question that was asked.
My understanding is that yes, I mean, all these medications disappeared in a 3-day period because I watched it. I watched it dry up from the national pharmacy chains like CVS, Walmart, or Walgreens, and I watched it dry up from the independent pharmacy chains, and then they blame the physicians. Oh, those darn physicians, they're writing it for themselves and they're just hoarding it. Well, you know, that's just an outright lie. Some of us may have purchased it for our patients because we just kind of had a hunch it might disappear, and it's exactly what did. So all that time, the FDA was saying, no, 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 we're not hoarding. We're not hoarding. We don't have it. We don't stockpile. We haven't stockpiled it. And then they go, oh yeah, we did. They did stockpile it, and then they gave it only to the hospitals, which I already told you is pretty much, it's not as effective as it really where it needs to be. My understanding, and Dr. Karladine can talk to this, but there's 6 different companies worldwide that make hydroxychloroquine. It's so easy, you could probably make it in a garage. Although I don't go do it yourself, and do not drink fish cleaner. I mean, seriously. So, it's almost comical, except some people fall for these kind of things. And so it is easy to make. My local pharmacists have told me they've got plenty in stock, but they're not, they're not prescribing it because the doctors now are kind of scared to use it, and they've been told that it doesn't work. So the whole thing is manipulative.
So bottom line is the drug is available. Novartis they donated 130 million doses. Bayer donated 30 million doses, and Teva, I think, donated 6 or 7 million doses, in addition to all the other stuff that's coming in. So the drug is there, everybody. We know that the FDA is, for political reasons, stopping this, and they're connected very much with Fauci, and it is impacting we the people. We are under a tyranny with our medical establishment, not physicians who care and treat you, but the establishment of bureaucrats that are totally deep state. As Dr. Karladine pointed out, Fauci has patents on parts of these glycoproteins that have been used for these super viruses designed to kill you. And then he also has patents on things that are going to be used in the vaccine, which brings me, should be to maybe my last question, unless somebody else has another one, but there's a lot here because we want to know how to proceed, because we feel more confident now that this what we can do to help ourselves. But if we can't get hydroxychloroquine, do you think quinine water helps?
No.
I have heard that. No.
I think that you'd have to drink an awful lot of quinine water. And I think that you would spend most of your time in the bathroom.
Okay. So we don't want to do that. So my last question here is from Lynn Goldhammer. She said, I saw an article that COVID-19 was patented in 2008. So was a vaccine for it. The vaccine was approved in November 2019, just before the virus showed up. Have you heard if there is any investigation being made into that? So what do you think?
I don't have any knowledge of that at all. There's no vaccine that is going to absolutely be anytime soon, nor should it be. Now, why? We've got to go back to common sense. The flu vaccine, every year it is changed. What we have in it. I want people to know on this call, only the flu vaccine is only about 30% coverage for us. Yet we take it every year. And what do you hear every year? Did you get your flu vaccine? Did you get your flu vaccine? But it changes every year. This virus, this COVID-19, we already know there's mutations out there now that have happened. How long have we had this virus? It hasn't been 3 or 4 years. It's been in the months, yet it's already changed. And so if you made a vaccine for this virus, say that we made it back in January, well, now it wouldn't even be really that effective. And they've made vaccines similar to this before with COVID. And when they've given it, it's actually killed those that they had given it to. And so it's very dangerous for us to think that we can come up with a quick vaccine. We shouldn't be even thinking about this because we don't even know what the virus is doing yet. So why would you make a vaccine with something that continues to change and is changing rapidly?
Well, Karladine, I read an article that said Pfizer has a vaccine that they plan to release in September. So perhaps that is the vaccine that had been patented and was approved in November of 2019, which we know that they had actually done a simulation called Event 201, what happens with the global pandemic, and they've been planning this. So this maybe, and Pfizer, it is true, they're planning on releasing something, but as you just said, the efficacy of what that vaccine is left to be determined.
Well, I think that the first two people that should take it is Fauci and Bill Gates.
I agree. That would be a great idea. So so most of everybody here has talked about the concern for wearing their face masks and what we need to be doing. And I think we've established that that's probably not necessary right now unless you have a condition where you need to be protected. But wearing it for any length of time will affect your ability to breathe properly. In addition, if you have any viral load there, it will only make it worse. So it makes no sense to do that. And that we have the opportunity with it's telemed, right? To be able to use the telemed people to get hydroxychloroquine. We still have a problem here in Georgia that we're going to have to address with our elected representatives to release the drug, and that we need to, what can we do? What's going on with Donald Trump? He knows about this. He knows about Dr. Zelenko. I think you guys have given him information on hydroxychloroquine, and he keeps bringing it up, but they keep beating him down on it. What's your thought?
I'm not sure exactly what he's supposed to do because, the top people it's so political. I will tell you, I had a patient just today. I told him about hydroxychloroquine, and he quote unquote said, I would never take that drug just because Donald Trump said it was good. And I was like, even if it meant that you could die? And he said, yes. So it's, Donald Trump, bless him, he's a lightning rod. And I think it's all political. And I think his hands are kind of tied when you've got all the major news media speaking against him. He can't say anything without it getting distorted and making all kinds of headlines. He has come out and said that it's good. And so I don't know how else to answer that. I don't know what he's thinking.
I don't think that he's pushing either for forced vaccines. I think what he is saying is that they're going to have I have heard, now maybe he has said that, I'll have to look at the newsreels, but I think what he has said is that there is a vaccine coming because that's what he's been told. Donald Trump is not a doctor. He's not a physician. He doesn't even try to be, but he has turned to what he thought were the experts and what he has been thinking are the experts. And supposedly they are supposed to be. But unfortunately, I think that he has misinformation, just like the majority of the American people at this time do. And I want to say this too, that I got a letter from Brazil today, and they think that America has gone absolutely crazy. They say, what in the world? Who told you people who did the testing that 6 foot apart is going to save you? Who did that double-blind study? Well, I haven't seen a double-blind study on being 6 foot apart. Does that really keep you safe? Not necessarily. We don't know that for sure. And they said, well, why is it that you people aren't using the hydroxychloroquine to save more of your people? What are you doing? And they really also feel that there are underlying possible nefarious reasons why we are not having this medication given to us.
Yes. So
I'm going to have to go. Thank you so much.
Thank you so much, Dr. Karladine and Dr. Vicki Wool. I will say one thing. Karladine, do you want to say that about your nonprofit at all?
We do have a nonprofit. It's a 501c3. Vicki and I both, personalized healthcare network. We want, what we really want is just to do what we were trained to do. And that is take care of the patient, not the paperwork, not the bureaucracy, because we want that patient-physician relationship back together again. So where we don't have a triangle in the room, where we don't have the government in the room, where we don't have the insurance company, we don't have the hospital administrators telling physicians what to do and how to do it. No, that's not what medicine is about. It's about a relationship. And for me personally, I call it the sacred relationship. So thank you.
Thank you, Karladine. God bless you. And thank you for everything that you've given us hope, and you've given us encouragement, and we're going to have a plan. We have to do it. The people have to do it. We cannot rely on anybody else.
If the people don't do it, then we have missed an opportunity. And I am telling you, I can see it in every area of life. We're going to lose this republic. And we're going to lose not just healthcare, but we're going to lose much more than that. And we will sit around and tell our grandchildren, our great-grandchildren, when America was once free. Thank you.
Well, we're not going to let that happen. We're going to try. Thank you, Vicki Wool, Dr. Vicki Wool. Do you have any closing remarks?
I don't. I concur wholeheartedly with Karladine, though. I live this. It's happening. Oh yes, I do have one other remark. Part of the warfare that is directed toward the people is through artificial intelligence, by taking narratives and spinning them every which way but loose. It leaves you off kilter. It leaves you frightened, and you don't know where to look for. You don't know where to look for truth. So when you start seeing these ideas pop up and they seem contradictory, know that it's actually a technology that was developed against ISIS, and that it's being used by the political parties to brainwash you basically. And it's all geared toward, again, probably disrupting the election process.
Right. You're right. So we have our marching orders. We need to know what we're doing in our individual states, talk to our elected representatives, get really smart about that, and not give up until we have complete access.
And call the FDA, call the CDC.
Yes.
Call them directly. Make their life miserable, please. Oh, please make their life miserable. They've made ours so miserable. I think turnabout's fair play.
I think that could be a campaign. I'll see about putting that together. Let's, call the FDA all within the same week, every day for 1 week.
I would love that.
So would I.
Oh, that would make a happy day for me. Thank you.
Okay. We'll ring that bell. Thank you. God bless you.
Thank you.
Thank you, everybody.
Thank you, everybody, for listening. And I tried to get everybody's questions. There were so many. If you have another question, let me know, and I will ask